What is Integrative Medicine and Will It Work for Me? I'm really excited to have a expert panel who each of whom are going to take about 5 minutes and kind of talk about where they have some expertise and experience in integrative medicine. And we will have some time at the end of their presentations for some questions from all of you. I will also encourage you to please go ahead and put your questions in the chat, and I will keep track of that for our speakers, and we'll facilitate some Q&A at the conclusion of our session today. So before we start, I thought I would share with the webinar participants the definition of integrative medicine that Intermountain Healthcare has adopted. And that is that integrative medicine is healing-oriented medicine that takes account of the whole person, including all aspects of lifestyle. It emphasizes the therapeutic relationship between practitioner and patient, is informed by evidence, and makes use of all appropriate therapies. And I think that particularly that last portion of the definition, makes use of all appropriate therapies, will be something that you come away from this webinar with an appreciation for, having heard from our panelists today. I do want to let you know that we were able to obtain a 1-year subscription to Headspace for a random participant in the webinar today. And Patty Taylor, who works with us in the Office of Health Promotion and Wellness, she will perform the random drawing of webinar participants, and will let someone know how they can access their free subscription to Headspace, which is a fabulous app. I use it. It's on my cell phone for mindfulness meditation. It's really great. So probably some of you are using it already because they did provide free access during the pandemic to providers. So let me introduce our panelists for today's webinar. First up, we have Dr. Tricia Rafferty. She is a pediatrician in Northern Utah Pediatrics, and I'll let her talk a little bit more about her background in integrative medicine. I'm really excited to have with us Zhui Fang. Dr. Fang is an acupuncturist up at the Park City Live Well Center, and he has an extensive resume in Oriental medicine. And again, I'm sure he'll talk a little bit more about that during his time. Liz Monson is joining us. I think we've heard from Liz before. She has a great deal of expertise in acupressure, and her role here at Intermountain is as a nurse practitioner with our heart failure and transplant team at Intermountain Medical Center. And last but not least is Cheryl Ledward. And Cheryl is not currently practicing within Intermountain as an integrative provider, but she has a great deal of background and experience here. She's a certified functional nutrition counselor, but she is the clinical manager for Connect Care. So really excited to have these experts join us this evening for the Live Well webinar. And so just in the interest of time, I am going to advance the slides. So each of the panelists will let me know when to advance their slides, and everybody has about 5 minutes, and we'll go ahead and get started with Dr. Rafferty.
Thanks, Liz. So I'm Dr. Rafferty. I'm a pediatrician up in Layton. I have been with Intermountain for 10 years now, and a few years ago, I kind of wanted to change how I was doing my practice, and so I completed a fellowship in integrative medicine at the University of Arizona. I completed that in 2020. So some of the slides that I'm going to show come from their slides that they present in the fellowship, and then we'll just talk a little bit about how, as a primary care physician, I use integrative medicine in my practice next. So integrative medicine believes that health is more than just the absence of disease. And I think that's something it's a different way of looking at healthcare. Rather than just going to the doctor to fix what's wrong with you, we're trying to keep you whole and healthy. Next. Sometimes people confuse integrative medicine with complementary medicine or alternative medicine, so I just wanted to give you the definition of those. If a non-mainstream practice is used with conventional medicine, it's considered complementary medicine. So if you went to your orthopedic surgeon for a knee injury and he sent you to physical therapy, that would be considered complementary medicine. If a non-mainstream practice is used in place of conventional medicine, it's considered alternative. So the extreme of this would be somebody who has cancer, who chooses to not do any kind of chemotherapy and instead is going to do like a diet to cure their cancer. Most people don't use true alternative medicine. They mostly use complementary medicine along with conventional treatments. Next. So complementary and alternative medicine is used widely in the US. This slide's pretty old. It's from 2018, and I would guess that the numbers are much higher now. So many Americans, more than 30% of adults and 12% of children, use healthcare approaches developed outside of mainstream Western or conventional medicine. Next. So these are the most common usage of medicines that people use, adults used in 2007. Natural products, so supplements, taking your vitamins from over the counter, deep breathing, meditation, chiropractic, massage, yoga. I'm sure some of you have tried these. I would say guided imagery is probably going up. Yeah, you can go to the next slide. And then since I'm a pediatrician, I looked at what kids are using. They're also using natural products. Lots of parents take their kids to the chiropractor, or they'll do cranial sacral massage. Yoga is being taught in schools now. Deep breathing is being taught by all the therapists. So I think these are getting used a lot more in mainstream practice. Next. And then people use them for all different things. But for kids in 2012, the most common reason people went was for back or neck pain. I would say parents in my office use it a lot for colds. They'll use like essential oils. Those pretty popular in Utah. Anxiety and stress using the Headspace meditation app. Next. So when you're looking for an integrative provider, these are some of the principles that they kind of practice with. They believe that it's a partnership between the patient and the practitioner in the healing process. So I'm not here to tell you what to do. This is a partnership for us together. We use appropriate use of conventional and alternative medicines to facilitate the body's innate healing response. So your body knows how to heal, and we're just helping your body along. We consider all factors that influence health, wellness, and disease, including your mind, spirit, and your community, as well as your body. And it's a philosophy that neither rejects conventional medicine nor accepts alternative therapies uncritically. So we looked at evidence-based medicine before we say, go try yoga. We look to make sure that it actually works for what we're treating. Next. And it's a recognition that good medicine should be based in good science, be inquiry-driven, and be open to new paradigms. So what worked today might not be what we use 2 years from now, where we're open to that. We use natural, effective, less invasive interventions whenever possible. And we use the broader concept of promoting health rather than just treating disease. And then a big part of my fellowship was the training that we have to take care of ourselves before we can take care of patients. Next. And I feel like this circle just kind of summarizes that our health is not based on one thing. All of these things combine together to make us a strong whole being. And so I try to practice this in my practice. And I hope that if you're interested in integrative medicine, that you can find a primary care physician who's also willing to meet you where you're at and help you be the healthiest person possible.
Oh, Tricia, thank you so much. That was awesome. It was a great way to kick off the webinar on integrative medicine. We're going to move to our next panelist, and that is Dr. Fang, who is going to provide an introduction to acupuncture. Dr. Fang, you can take it away.
Okay, thank you, Dr. Joy. Hello, everyone. I'm Zui Fang, diplomate of Oriental Medicine, licensed acupuncturist in Park City Hospital New World Center. Today, I would like to talk about acupuncture. Next, please. What's acupuncture? Acupuncture is a holistic health technique that originates from traditional Chinese medicine. It is an important part of TCM. It's been used for thousands of years to help people become well and stay well. Next. That's the number two. What's acupuncture useful for? That's the very common questions people would like to ask. Acupuncture has been used for thousands of years. It's been used for a lot of medical problems. For example, pain management. That should be the most common problem in acupuncture clinic. For example, the headache, migraine, pain in the neck, back, the sprain, strain, sports injury, joint pain, and the neuropathy, stress, depression, anxiety, and some gynecological problem, and the post-stroke recovery, and also smoking cessation, and health maintenance, and things like that. Next. How safe is acupuncture? The acupuncture is very safe. It's a natural therapy, no side effects, and only sterile single-use needles are used. Next. Do the needles hurt? Generally speaking, no. During the treatment, most people feel no pain at all. Sometimes some people might feel a little bit heavy during the treatment, and that's a normal sensation. Next. Yeah, how deep do they go? And it depends on specific locations of acupoints, and typically needles are inserted at depths ranging between 1/8 inch to 1.5 inch deep. Next. Yeah, how many treatments will I need? It varies from person to person, and some people may experience immediate relief, and others may take longer to achieve results. And generally speaking, the chronic conditions usually take longer to resolve than acute ones. And the treatment frequency depends on the variety of factors. And generally speaking, 1 to 2 treatments per week, or every other day treatments, or monthly visits for health maintenance may be suggested. And generally speaking, one course of treatment consists of 7 to 10 treatments. Next. Yeah, how does acupuncture work? That's the there are different kind of theories. But for the specific the mechanism is still unknown. Next. Yeah, what can I expect? And let's say, generally speaking, the needles once inserted will usually be left in place from 15 to 45 minutes, and generally about 30 minutes. And the length depends on the specific conditions of patients. And the visits range from 30 to 90 minutes, generally about 60 minutes. Next. What should I expect during treatment? During treatment, generally speaking, some people might feel a little bit heavy, numb, sore, things like that. And all those feelings are normal sensation and a good sign. And after that, you may feel energized or a deep sense of relaxation and well-being. Next. Oh, thank you all. I'm done.
All right. Dr. Fang, thank you so much for the whirlwind tour of acupuncture. I have heard from many that they have benefited from his treatment up at the Park City Live Well Center. And certainly if you're at all interested in utilizing acupuncture as a way to treat a health condition, please do not hesitate to reach out to him.
Okay, thank you very much, Dr. Joy.
Thank you. And again, Dr. Fang will join us at the conclusion for some questions. Next up is Liz Monson, who is going to talk with us about acupressure, particularly with respect to therapy for pain and anxiety. So Liz, I'll turn it over to you.
Great, thanks Liz. And hello everyone. I'm very excited to speak today. My base is in cardiology, but my passion is integrative medicine. And this is a wonderful lineup. This is following Zhui. So acupressure is born out of acupuncture and uses the same system. So I want to share with you a little bit of knowledge about it and some progress that I've done in my own career working with this therapy. Next slide. So defining what acupressure is, it's basically applying finger pressure to specific points on the body. These points correspond with the acupuncture points and the lines of energy that are used in traditional Chinese medicine. So we use the same points as basically as acupuncture, except using finger pressure instead of needles. It is truly a holistic therapy. So people may come in looking to address specific physical symptoms, but it also helps with emotional states, with mental patterns and the spiritual dimensions of what people may be dealing with at any given time. And it does a very basic work of balancing both the parasympathetic and sympathetic nervous systems. Next slide. So to just elaborate a little bit more, the parasympathetic system is the rest and digest. The sympathetic system is the fight or flight response. When you activate either one of these branches of the nervous system, you have specific effects on the physiological body that can affect the hormones that are released. They affect your immune system. They even affect your emotions and your thoughts. So the whole basically target goal is to balance both of these symptoms. Obviously, we can't rest and digest the whole time, and we don't want to be in fight or flight. So we want to be able to find that balance between these two activities. And that is really the goal, I think, of any integrative therapy. I love what Tricia said about we're really just working on enabling getting the body in a state where it physiologically knows how to heal itself. And so if we can avoid those big highs or those low lows, we can optimize that homeostasis, that body's ability to heal itself. Next slide. So the origins of acupressure actually go back much farther than any recorded medicine. So when people say this is new age, I was like, well, actually it's about 5,000 years old. This is a slide to illustrate it. I don't know how many of you know about Otzi, but this was one of the most supreme scientific discoveries of this century. Otzi was discovered as a result of climate warming. He was found in a glacier, so his body was perfectly preserved. And when they actually went and did carbon dating, he came out at 3,400 BCE. So he was quite old, about 5,500 years ago. As they were studying him, they noticed that he had tattoos on his skin, and they were very curious about this. They didn't know if they were tribal markings, but ultimately what they found out was that they possibly correlated to points on the traditional Chinese medicine system with acupuncture and acupressure. And when they went and correlated these points with actually physiological disease systems, they correlated with stomach ulcers and osteoarthritis. As they examined Otzi, he actually had both of these conditions. So that was some pretty strong evidence that this, touching, feeling, massaging into these points actually has direct physiological benefits. Next slide. So one of the things that I've done with this work is try to move it into the hospitals and also work with healthcare professionals. And a few years ago, we designed a study looking at the effects of acupressure on self-rated scores of pain and anxiety. We applied a 16-point acupressure protocol that's specifically used to treat these symptoms, and we rated people's pain and anxiety scores before and immediately after the treatment. Next slide. So these were our results, and if you look at these, this graph, the blue bar represents the average of the pre-treatment scores, and the orange bars, the post-treatment scores. And if you just look at this generally, you'll see that the greater the pain, the more the effect of the acupressure protocol across this generation. Next slide. And this was the scores for anxiety, again, rated 0 to 10 on a scale. The results with anxiety were even greater, up to a 5-point drop in anxiety scores. among hospital patients and about 3.5 for nurses and 1.5 for general. Next slide. So how does this look in action? Well, I just wanted to share a case study. This was pulled among some of our inpatient files. There was a patient that we were treating who's 57. He had just undergone bypass surgery. Unfortunately, 3 out of 4 of his bypass grafts had prematurely closed, and he came in, he was in a lot of pain with his chest. We had him on multiple drips to try and control this pain, and we were not making any headway despite all this intervention. And at the time that we started, he rated his pain as 8 out of 10, 10 being the most significant intensity. We performed just 20 minutes of acupressure on him with the same protocol, and immediately post-treatment, his pain was down to a 3. And that held him until we could get in and do a salvage intervention. And we continued to do treatments on him and were able to wean him off all of the pain medications prior to discharge. Next slide. If you're interested, this is a wonderful field that has just opened, I would say, in the last 7 years. There's so much research now about using acupressure for cancer, for labor and delivery, musculoskeletal pain, and also anxiety. So I'm very excited to see the avenues that we can travel at Intermountain to begin to bring these therapies forward into our conventional treatment systems. Next slide. Thank you.
Thank you so much, Liz. That was fabulous, and so much value that acupressure can provide to our patients. And when here we are in the midst of our second pandemic, maybe the first being the opioid pandemic, and to be able to have alternative interventions, such as acupuncture, as Dr. Fang just presented, and acupressure. It's so fabulous. But maybe one of the things we'll talk about in the chat is how do we help people access these kind of resources as an alternative to kind of more traditional allopathic approaches to pain management. So thank you very much for sharing.
Thank you.
Our next presenter is Cheryl Ledward, and she is going to present on integrative approaches to insomnia. Cheryl, take it away.
Great, thank you so much. Well, I think we, very comprehensively, we've spoken about the definition of integrative medicine. We have spoken about how it's approached in your whole health and well-being. We have spoken about one of the modalities. We've done a condition, pain and anxiety, and now we also are going to be looking at an integrative medicine approach to another condition, insomnia, and I have the privilege of speaking to this. Next slide, please. So the definition of insomnia, this is a very simplified definition. It's actually quite complex, but insomnia is characterized by difficulty initiating and or maintaining sleep or experiencing early morning awakenings. Next slide, please. So it's actually very common. It affects 1/3 of the population. When it becomes chronic, it's known as insomnia disorder, and it impairs daytime function. It can lead to absenteeism in the workplace. It can exacerbate cardiovascular disease, diabetes, obesity, as well as worsen mood or cognitive function, and so really can have an impact over your overall health and wellness. Next slide. So it's often inadequately discussed or assessed in a primary care or hospital setting. And so there's this gap between the clinical practice guidelines for evaluating and treating chronic insomnia and the current clinical care that a patient gets. And so given this gap, patients commonly self-treat with alcohol or over-the-counter prescription sleep aids. In fact, nearly 20% of people suffering with insomnia have used an over-the-counter or even a prescription sleep aid within the past month. Next slide. So how is insomnia traditionally treated or allopathically treated? Often with a sleep study and then a prescription for a CPAP. We are starting to see cognitive behavioral therapy being used to improve sleep hygiene, for example, or habits. We'll talk about that in another slide just a little bit later. But most often, insomnia is traditionally treated with pharmacotherapy, and benzodiazepines is what is commonly prescribed. Next slide, please. So what are the concerns about using pharmacotherapy as a primary treatment therapy? Well, benzodiazepines are dependent. They once you start on them, you can't just suddenly stop. You have to be weaned off of them. There is an increased risk of falls in the elderly because some of the side effects with them are dizziness and unsteadiness. It can also lead to psychiatric or other medical conditions. One of the side effects is depression. And there is also an increased risk of accidents, especially if people are driving while they're on these sedatives. Next slide. So can we do better? And we feel absolutely, given these concerns and patient preference often for a non-pharmacological treatment, we feel that it's important to, in addition to what is traditionally prescribed for insomnia, that patients be offered evidence-based non-pharmacological approaches that may improve their sleep. Next slide. And so, again, just a reminder, what is the integrative medicine definition? It's a healing-orientated medicine that takes account of the whole person, including all aspects of their lifestyle. It emphasizes that therapeutic relationship between the practitioner and the patient. It's informed by evidence, and it makes use of all appropriate therapies. Next slide, please. So how would an integrative medicine practitioner approach the evaluation of a patient? And so it's much more comprehensive. Because of that definition, we consider the whole patient, physical, emotional, spiritual, and even all aspects of their lifestyle. And so some of the things we might consider are antecedents, and those are things that that are already existing in the patient. They're already there. For example, the patient may already have nutrient deficiencies. They may be already perimenopausal or in menopause. They may already have this habit of mouth breathing instead of nose breathing. So we look at those kinds of things. We look at triggering events. So we'll ask about that. We'll ask about, did this start after a particular event? Did this start after you started taking care of a family member? Does this happen when you're in your luteal phase of your menstrual cycle? Did this start happening when you started experiencing acid reflux or menopause, for example? We ask about mediators. Those are things, what makes it better, what makes it worse? So is it worse for caffeine? Is it worse for certain habits, like do you watch the news right before you go to bed, and so that makes you anxious about the state of the world and those kinds of things? We ask about environmental inputs like blue light. For example, are you sitting in front of 3 screens like I am till 11 o'clock at night, and then you're trying to go to sleep? That blue light is actually signaling to your brain that it's still daytime. Do you have a good quality mattress? Do you live on a noisy street? Do you travel frequently for work? Or are your work schedules inconsistent? All of those things. We look at physiological. Is it pain that's keeping you up or waking you up? Do you have restless leg syndrome? Do you need to empty your bladder? What type of medication are you using? We look at hormone production, especially those hormones that are related to your circadian rhythm. Psychological, we'll look at stress, anxiety, depression, any addictions. And so we actually we kind of put all of these things on what we call a matrix. And I'll just show you an example. It's something like this. And so we get a very comprehensive picture of you as a patient and all the things that could be affecting that particular condition that we're assessing. And so we, like clearing the muddy waters, peeling back the layers of the onion, really getting an in-depth understanding of you as the patient. And then we're able to match some of the therapeutic options to you, the patient. In that therapeutic relationship, it'll always be a discussion. Next slide. And so some of the complementary treatment considerations for insomnia could be guided relaxation, mindfulness and meditation, nose breathing technique training, changing the timing of your last meal to reduce acid reflux, discussion about diet and supplements, especially if we've tested and found that there are some deficiencies like vitamin D, magnesium, zinc. We could even talk about other supplements like valerian root, chamomile, melatonin, some teas like chamomile or oils like lavender. You could diffuse that in your room, which is very relaxing. Next slide. We could even consider a weighted blanket. We've spoken about touch and feel, and that weighted blanket triggers that parasympathetic shift from sympathetic to parasympathetic, so to your rest and digest. We could talk about gentle movement in the evening, which is relaxing, like yoga or Tai Chi, acupuncture or acupressure, as we've already spoken about, massage and touch to support oxytocin release, and oxytocin counters cortisol. And so that helps you to connect with someone, also to feel loved. And that comes with, massage and touch. We can even talk about a liver cleanse, because liver challenges are linked to poor circadian rhythms, can be also linked to lower levels of melatonin production, and even increased production of cortisol, all of those things. We can even talk about wearables, and there's so many things on the market, and a lot of them do have clinical research to support them. For example, I'm wearing an Aura ring. That gives you information about the quality of your sleep. How much time did you spend in deep sleep and not? And so, those can help you get a better understanding of your sleep. Next slide. If all of these things don't work, there's even deeper investigation, like we spoke about, a sleep study, specialized testing like serial cortisol testing over 24 hours, so that we can see if it's following the correct diurnal pattern that it should be. We spoke about continuous monitoring with wearables, and even some more advanced neurological testing, because there are some neurological conditions or disorders that do affect sleep, like epilepsy, Alzheimer's, neuromuscular disorders, stroke, Parkinson's. And so we can even talk about that as well. Next slide, please. And so Intermountain's mission is helping people helping people live the healthiest lives possible. And integrative medicine is a healing-orientated medicine, and it focuses, as we've said, on the mind, the body, and the spirit, and emphasizes that therapeutic relationship in personalizing the treatment plan using appropriate therapies for the patient. And these are just some additional, if you want to look at research of some of the therapies that I mentioned, that's on that slide. And that's it. Thank you. Okay.
So thanks everyone on the panel for your contributions. And I'm afraid that we are a bit past time. I'm going to encourage people who have any questions for our panelists to please put them into the chat, and I will circulate those questions to either Dr. Fang, Dr. Rafferty, or to Cheryl. Our next webinar is on Wednesday, November 3rd, and we'll be addressing motivation, habits, willpower, and small steps. And we thought that was well timed as we go into the holiday season. So thanks again, everybody, for joining us, and have a great evening, and watch your email to see if you won the 1-year subscription to Headspace. Thanks again. Have a great evening. Bye-bye.
Thank you.